Hi class, my name is Sierra Rosales and the genetic disorder that I chose is Marfan Syndrome. Marfan Syndrome is a systemic disorder of connective tissue caused by mutations. It is autosomal dominant, which means that even if there's a normal copy, a single mutated copy, so a heterozygous mutation, is sufficient enough to cause this disorder. It is characterized by abnormal manifestations in the skeletal, cardiovascular, and ocular systems. As you can see in the figure that I included to the right, with the skeletal system, it interferes with normal development of the bones, and in regard to the cardiovascular system, this is actually the most dangerous complication that is linked with this syndrome because it does involve the heart and blood vessels. Faulty connective tissue can weaken the aorta, which is the large artery that arises from the heart and pumps blood through the body. This could lead to an aortic aneurysm, aortic dissection, or even valve malformations. With the ocular system, this could lead to lens dislocation, retinal issues, or even early onset cataracts. So moving along, the most major phenotypic feature is a tall and thin build with disproportionately long arms and legs, which is referred to as the Marfanoid body habitus. Another common trait is arachnodactyly, which is a reference to the long legs of spiders, and this is characterized by long, thin fingers and toes. Due to the overgrowth of the chest, it could lead to pectus excavatum, which is the dip or indentation of the chest, or it could lead to pectus carinatum, which is where the chest protrudes out. Other features include a downward slant of the eyes, inability to extend elbows a full 180 degrees, a narrow palate which causes teeth overcrowding, scoliosis, which is the sideways curve of the spine, and flexible joints. So here I've included some examples of pictures, and in the first picture you can see that the build is very tall and slim, like I talked about earlier. In the second picture, you can see that the fingers are very long and slender. And in the third photo, you can see that the feet and toes are very long. And also, if you notice that the feet are very flat-footed, that's also another common trait. So Marfan syndrome affects about 2 to 3 people per 10,000 individuals and about 1 in 5,000 people in the United States. It's usually not noticeable at birth, but occasionally it can be present, and when it is, this is referenced as neonatal Marfan syndrome. The protein that plays a role in Marfan syndrome is called fibrillin 1, which is FBN1. So what happens in Marfan syndrome is that it's caused by a mutation in the gene that tells the body how to make fibrillin 1. This mutation results in an increase in a protein called transforming growth factor beta, or TGF-beta for short. The TGF-beta increase causes problems in the connective tissues throughout the whole entire body, which in turn creates the features and medical problems associated with Marfan syndrome and some other related conditions. The syndrome can be challenging to diagnose because there are many connective tissue disorders that have similar symptoms and signs. However, although this disease is hard to detect, genetic testing, family history, and imaging technology such as echocardiograms and computerized tomography scans can help narrow the diagnosis. The eyes, heart and blood vessels, spine, and skeletal systems are also all examined. In 2006, the Marfan Foundation formed a partnership with the National Heart, Lung, and Blood Institute's Pediatric Heart Network to develop the largest ever clinical trial on Marfan syndrome. This involved 21 clinical centers in the United States, Canada, and Belgium, and they recruited 608 volunteers ranging from 6 months to 25 years old. The study focused on treating the enlarged aortas of individuals with the syndrome, while also comparing 2 different drugs, losartan and atenolol, for treating this condition. They found that both are actually safe and effective in reducing the rate of aortic enlargement, and the finding helped expand therapeutic options for people with this disorder and paved the way for future studies on treatments. So while there are no cures for the syndrome yet, there are, however, treatments for some clinical features. for dislocated lens, a replacement artificial lens is an option, and for a wide aorta, surgical repair, beta blockers, or angiotensin receptor blocker, losartan, are options. As understanding the cause, pathophysiology, and treatment of Marfan syndrome and knowledge of consequences of fibrin 1 deficiency develops, it's anticipated that advancements will continue to be made in treatment options. The phenotype becomes more apparent with increasing age in most families. Family history of Marfan syndrome is not always present as an obvious risk factor. However, though, there are majority of people who do inherit the abnormal gene from a parent who has the disorder. About 25% of the cases are sporadic due to de novo mutations, and this occurs worldwide and affects either sex and all races equally. So as you can see here, I've included my mega phylogenetic tree for FBN1, and as we go down the list, we have chimpanzee, bonobo chimp, human, orangutan, baboon, goat, leopard, and walrus. Last but not least, here is my literature cited, and thank you so much for watching.